Good afternoon, everybody. My name is Marty Guthmiller, and I'm CEO at Orange City Area Health System, bringing you today on January 25, 2021, the 89th COVID-19 community briefing. As has been our plan and function, I'm going to provide, first of all, a local scoreboard, simply because for those of you keeping score at home, it's something of interest to you. 1,765 positives of the 8,739. Now that's our gross number, and that percentage positive is 20.2%. More importantly than that number, though, is how many tests we did in the last week. We only performed 100 tests, 100 even tests last week. Even better than that, only 7 of those were positive. So last week we had a 7% positive rate here at Orange City Area Health System. Definitely good news and one of the lower rates in many, many months. Sioux County is the 14-day average, and all of our numbers today are good. The 14-day average in Sioux County has dropped to 10.1%. We're almost in single digits for Sioux County on the 14-day basis. The 7-day average is and remains in single digits at 7.2%. Just as an idea, that number last week in Sioux County, the 14-day average was 14.3. Today we're 10.1. Last week, the 7-day average was 8.5, and today it's 7.2. So very positive moves there. The positive percentage per 100,000 population over the last 7 days in Sioux County is 128.9. That is a drop of 75% from the previous 7-day period. Sioux County as a total is 4,597 individuals of the 14,032 tested. Again, the more important number there perhaps is how many this week, and that is 59 new positive individuals in Sioux County, 59. The week prior, it was 65, and the week prior to that was 102. So clearly trending down in Sioux County. Stepping up then to Region 3, the 20 counties in Northwest Iowa, we have 50 hospitalized COVID patients. That number is down significantly from the previous weeks. A week ago, 76, 2 weeks ago, 91, 3 weeks ago, 83. So 50 hospitalized in the 20 counties in Northwest Iowa. 6 patients in the intensive care unit. 3 of those patients on ventilators at this point. So both of those numbers are down and good numbers for sure. Iowa, 14-day average is 11%, 11.0%. The 7-day average in Iowa, 8.5%. Again, looking back to a week ago, the number in Iowa was 12.9. So we've dropped almost 2% in the 14-day average. And the number a week ago was 9.2 on 7-day average. And so again, a drop to 8.5. The positive percentage per 100, or the positivity per 100,000 population, last 7 days in Iowa is 218.6. That's down 0.5%. So pretty steady with that metric in the state of Iowa. But again, compare the 218.6 to Sioux County's 128.9. Again, Sioux County is much lower than the state right now in terms of the infectivity rate. In the number of hospitalizations in the state of Iowa, where Iowans are hospitalized somewhere with the COVID diagnosis, the number of those folks is 382, down significantly from where we've been in the past. A week ago, 483. A week prior to that, 541. So those numbers are down. In Sioux County, 6 Sioux County residents are hospitalized. That number is up, 5 from a week ago and 3 a week prior to that. I can't really address the specifics of the decrease in terms of the disposition of those patients, whether the patients passed away, whether the patients got better, whether they went somewhere else or did some. I just don't have that data. And so generally speaking, when we move from last week at 483 to this week at 382, that's an extremely positive move. And I think for right now, we just have to accept that that's positive. And certainly not all those 100 patients died. So the drop in patient census is largely and in a high percentage that the patient recovered and the patient got better. And so I think we can take those and accept those numbers in that light. The only number that is not good this week is again the number of deaths, and a reminder that this thing isn't over. We had 164 additional deaths this week in Iowa. The number is 4,488. In Sioux County, we have an additional death this week, and the official number in Sioux County is 57. So again, a reminder that this thing isn't over, as we've been saying repeatedly over the last few weeks. So those were the stats. Again, very encouraging numbers, and that's good. We need to be grateful for that. I want to talk a little bit about a couple things. The vaccination schedule coming up. I also want to talk about some of the things that we've been doing here basically since March. We've implemented many things to try to fight this virus. Negative pressure rooms, where we make our hospital rooms negative pressure so that it protects our people, it protects other people in the hospital, where the air pressure vents all the air when you open the door out. And that's very good. It's not something that is mandated. It's something that we've been able to create here on the fly, and probably will be something that we make a permanent feature of our hospital, our environment moving forward. And kudos to our maintenance staff for being able to do that. Also along those lines, just at last week's board meeting, our board approved the implementation of a global plasma system. And what that is, it creates an ionization process that cleans the air from not just the SARS-2 virus, but many other pathogens as well. And those things will not only fight currently what's going on with SARS-2, but will be with us long-term into the future to fight other pathogens that are in the air and to clean the air. We have utilized advanced therapeutics throughout the course of this marathon to include things like remdesivir, hydroxychloroquine, convalescent plasma. We've used those things and will continue to use those things when the patient situation merits those kinds of things. We've implemented high flow oxygen. We've accessed specialty services of Sanford in terms of using therapeutics that they've used, using techniques they've used, picking their brain in terms of what's going on, and other sources around the country as well. Many of these items are not appropriate to address from a social media standpoint, particularly the use of advanced therapeutics. And those are really between the patient and the physician, given the uniqueness of each patient and the uniqueness of the situation that is present at any time. So I just wanted to give a little bit of a rundown of that. we've been as proactive as we can be. Extremely proud of our folks in terms of what we've been employing and what we've been able to do. I want to move now a little bit into the vaccination process that we talked about on Friday's briefing. Not much has changed at this point, so that's good news. Beginning this week, Wednesday, our clinic will begin accepting appointments for anyone age 65 and over. And these appointments will be for the COVID-19 vaccination. One of the things that we will expect or what we would ask is that on our website, we hope to have at ochealthsystem.org a form, and we would encourage the completion of this form in advance of your appointment. If the form isn't there, or you can't find it, you don't have a printer, you can certainly fill that out when you get here, but it would just speed things up a little bit if you could have that done in advance. Again, ochealthsystem.org, and we'll try to have a button on there to get that form. Again, if it's not there, don't worry about it. The form will be here. Those appointments beginning on Wednesday morning will be scheduled on a first come, first served basis. Volume. That's the key to the whole thing. We are guessing right now at the number of appointments that we can have and can schedule based on, because it doesn't do us any good to have an appointment if we don't have the vaccine to give during that appointment. So we're guessing at this point. Each Wednesday, starting this Wednesday, we will be informed and we will know approximately the number of doses that we can expect for the following Monday. Right now, we've taken a shot at that. We remain kind of underwhelmed by the number of vaccine doses that we can get. We can give many, many more than we've been getting. And so it's all about quantity. So we're guessing right now we can maybe schedule more clinics, more appointments if we have more doses. We're probably at a point where we're going to be calling people back because we ran out to reschedule. That more than likely that's where we're at, but we're doing our best to minimize that and to get as many doses in the arms as we possibly can. One of the things that you might be hearing a little bit about is the Hy-Vee, the Lewis Drug, the Walmart foray here into the state cutting the deals with any of those people. And quite frankly, the only thing that would accomplish in our area for sure is a diversion of supply. We can give as many shots as we get doses. The issue is we just do not get the doses. And so don't be too confused that Hy-Vee's out there. And again, nothing against Hy-Vee, nothing against Walmart, but that would just mean that they get the supply that would have come to us because the supply has to go somewhere. And again, no one can help, whether it's Amazon or Hy-Vee or Walmart. Nobody can help if you don't have the doses. And so the issue repeatedly that we've been saying is that it's all about the doses. When we have the quantity, when we have the volume, we will get it in people's arms. There's just no question about that. And so I just wanted to give you that bit of information so that a little bit of clarification, education, and we'll see how the week goes. Again, I'm not anticipating a briefing later this week. More than likely, we'll be back in touch and publish something again next week, Monday. We'll have a better idea what our volumes are. We'll have a better idea how the scheduling is going. And so stay tuned for that next week. Until then, we ask that you stay vigilant, that you stay strong. This is again an endurance race, and it wears on us all. That you extend a grace to those around you, and and you're willing to receive grace as well. And above all else, we hope that you stay healthy. Thank you again for joining us today, and we look forward to seeing you in future briefings. Thank you.